Hi there, I'm Josh. I am the founder of Reflex 18 and this is my first post into a YouTube channel. So starting to make the dive into here. What I would like to get across in my channel is things that I come across in physio life, working with clients, kind of my philosophy on treatment, and also some of the struggles and barriers that I come up against in running a business and building a business. So for context, Reflex 18 is a multidisciplinary clinic based in Colchester in Essex in the UK. We started just myself in a room. We built that to a 3-clinic practice and have recently moved into our new facility, which has 6 clinics. We still have our previous facility as well. So in total, we now have 9 clinics with a gym and a Pilates studio. So the next year for us is going to be a really good one to come on our journey with us for, so that we can show what it's like to build a business. But more than that, I want to kind of talk about my philosophy and things on physio. Today, I wanted to talk about why recovery fails when we just focus on strength. And this is something that we probably see quite a lot in our clinic. When people ask me what kind of people that we see in clinic, it's always quite a difficult one to answer. Now, my view is that the patients that come to see us or clients that come to see us are generally those of an active background. So it's quite rare that I would see somebody who has back or neck pain just from sitting in their chair for long periods of time, but that's not really the type of client that we see here. I wouldn't say that we see athletes as such all the time, although we have a good proportion of those people, but there's certainly people that want to be active. So that might be that they enjoy walking, they enjoy running, they go to the gym, and essentially something is stopping them from being able to do that, and that's why they come to see us, as opposed to sitting on at a desk and struggling there. So that kind of puts these things into context a little bit. So when someone does come to see us and they've got this persistent pain that has been nagging away, and potentially they've seen other people, or they've sort of Googled and things like that, and they've started some strengthening exercises. Now, don't get me wrong, strengthening exercises are very, very important, but I think it's really important to understand that that's also not the only component of fitness that keeps you pain-free and keeps you healthy and active. So I kind of see strength training as a bit of a baseline. Kind of you need this foundation across the bottom, or below that even your aerobic capacity, I suppose, but strength training down near the bottom of the foundation of this pyramid. If you don't have a base level of strength or the ability to produce force, then it's really hard to build some of the blocks on top of it. For example, if you can't produce enough force to get you up the first step at home, then how can you ever get up? There's no good learning the movement pattern to get up the first step at home, because you just don't have the force capacity to do that in the first place. And so in those instances, it's really important to look at force production or strength. So people that come to us who have been focusing on their strength and have gone through a process and have got stronger, they'll quite often turn up and they'll still have their pain, or their pain has come back again. It seems to have improved. They went about their business, they went doing the things that they would normally do, and then the pain just comes back. And so starts to question, is strength the only thing that's important, and are there other things that we need to consider? And I think the answer to that for me is absolutely yes. So the I suppose questions in my mind started to form when you start to consider someone, let's take a knee pain for example. It's quite classic. If you get pain in the front of your knee, you go to see a clinician and you'll be given quadricep exercises 9 times out of 10. Now that's important. There's a lot of literature to support the use of quadricep exercises for knee pain. I'm not disputing that. However, again, sometimes that doesn't make you better. So what I noticed over the years is you would would take some measures. So we use the valve dynamometry to take measures. So it's a handheld dynamometer and you push against it. So we can measure quadricep force production relatively simply and relatively quickly. So there were many, many instances where somebody would come in for a first appointment, you would measure their strength, you would see that they had a deficit in comparison to their asymptomatic side. You would put together a program, you would give them that program, they would come back in X amount of weeks, you would then retest that strength and you would see that that person has improved significantly and maybe just as good now or within normative ranges of the other side. Now, the problem there is that a lot of the time, or not a lot of the time, some of the time, the range would be normal, but they would still have their pain. And that could be down to tissue healing times and that it needs a little bit longer for the tissues now to adapt, and we need to increase capacity and things like that. Yeah, but I suppose it all comes back to the point that the strength is not just the only thing. And it started, when I started to identify that and reflect on that, I started to kind of consider why that might be the case. And then if you extrapolate that further and you think, okay, so if an athlete's coming in to see me, so say we have a strongman that's come in or a bodybuilder that's come in and they have very, very, very strong quads, okay, and their pain is happening when they're getting up out of a chair, is that really a strength problem? And when I measure them, if they show that they have full strength in that side, what do I do then? I think the thing with very trained individuals is that they're working so close to their maximum capacity already. So if I try and draw this on the whiteboard, using the whiteboard for some of these things. So if this bar is your full capacity, okay, so that's 0%, your potential to produce force, okay, and this is 100%. So this is if I was 100% trained, I was getting everything out of my body that I possibly could. These are the real high-end elite athletes that, have really got it. No one's really hit 100%, but we have the capacity to achieve a certain amount, and we don't necessarily know where that is, but it's there somewhere. Okay, now in a trained athlete who's doing their strength training regularly and staying on top of it and things, quite often maybe they're sitting. I'm just using random numbers. There's no science to these numbers. They're just easy numbers for us to kind of think about. So say a really well-trained individual is actually using 90% of their capacity, their potential in their muscles. So their quad has the potential to produce X amount of force, and they're using 90% of that capacity in this instance. Now, if I want to get that person better with a traditional physiotherapy strengthening program, then what I need to try and do is improve that 10%. Now, anyone who's been training for a long time will be able to tell you that as you move up your potential, or your used capacity, I suppose, the amount of force that you can produce, it gets exponentially harder for you to improve your strength. If you're a runner, you could consider this too. So if you've been training for 5Ks for years and years and years, if you remember back to your first 5K, maybe it was a 30-minute, 25-minute, something like that, 5K that you ran, and almost every single run that you do would come down and down and down and down, and it would improve so quickly until you hit a certain point, and then it would be really, really hard to improve even a few seconds really on a time. And the way you feel each day will make a difference to how fast you run. Whereas when you first start training, you get up in the morning, and it didn't really matter how you felt, you're always going to run around about the same time, and you probably even continue to get quicker even when you've had a bad night's sleep. It's just when you're first starting out, it's really easy to get changes. On recording this video, it's December. in January, we're going to see exactly the same thing. Everybody joins the gym, gets in the gym, does their exercises for the first time. For the first 3 months or so, it goes really, really well. And every time they go into the gym, weights go up and up and up and up and up, and it works really, really nicely. And then at 3 months, we see that slip off where people start to drop out of the gym because they stop seeing that improvement. And that's essentially what I'm describing here is the further you get along that continuum, the closer to using all of your potential capacity, the harder it is to then improve on from there. So essentially what I'm saying here is that person that comes in with the knee pain, that's using 90% of their capacity, getting this in here is really, really hard, and it's going to take a really, really long time. So if I want to improve that, we're going to be doing this for a really, really long time. Now, in contrast, if we have, for example, an incredibly sedentary individual, so someone who doesn't go to the gym, doesn't do any regular exercise or anything like that, same problem, knee pain, getting up out of the chair, but they historically have only been using kind of 10% of their potential capacity. Now it's really obvious to see here that you could get some really quick, easy wins by just getting them stronger, because we know that in randomized control studies that look at using quad-based exercises for knee pain, is that generally people do get better. And that might be for various different reasons, and there are various different theories as to why that might be. But for me, you have to be able to improve a certain amount in order to be able to see that benefit. And so that person who's got very low ability in their quadricep muscles is going to have such an easier time in getting those quick wins in comparison to the well-trained athlete who's sitting at 90%. And so this is where my approach to these things would be different depending on the person that came in. So like I say, we don't see many sedentary individuals here, but I remember back to my time in the NHS and things, gentle, basic, simple quad strengthening exercises or quad activity exercises would we'd give out all the time, and it would almost be a set menu, but it worked. And I think it's the group of people that you're tending to see that makes a big, big difference to that. So I'm not saying that we shouldn't do quadricep exercises, and I would still do them with the high-end athlete, but I wouldn't give them on their own for somebody who I think is working closer to this 90%. That's where something different needs to come in. With my low-level individuals, post-surgical individuals and things like that, where they've lost capacity in their quadriceps, and yeah, of course we're going to have a much, much greater amount of quadricep focus when we do these exercises, and that's kind of my theory and my thoughts around it. So then it leads on to kind of the question of, okay, so what do you do then? So with somebody with close to their full capacity with regards to strength, and with anterior knee pain, what kind of things would we do then? Well, you've got to look at some of the other elements to this. So for example, the quad is really, really important, but there are other muscles, and it's not necessarily all about strength. Sometimes it's about co-contraction and things working together. It amazes me sometimes by the number of people that you see, and when you go through their history, you start to identify reasons why their knee might have to be working that little bit harder. Again, kind of a reflection of my own, I suppose, is thinking back to days when someone would sit in front of you and you kind of diagnose anterior knee pain, and then they'd say, okay, so why did I get it in this knee and not the other knee? And as a physio, you're always taught really that musculoskeletal pain generally affects one side and not the other. If it's bilateral, if it's on both sides, quite often that's something else going on inside your body. And so my answer would always be, well, actually, that's normal. It should happen just on one side. We're asymmetrical beings, so we load one side more than the other. And actually, if things start to happen on both sides, then that's when we start to worry, and when we have to start to send for things like blood tests and things like that. So that was kind of my explanation. I think I still agree, and I still buy in, and I still believe many of those things. We are asymmetrical, and so therefore we would naturally use one side and not the other. But I think in more cases than not, there probably is an answer in the subjective history that tells us why that person is having this on the side that they are. So it's about looking at what's happening above and what's happening below. So we would have a look at, for a knee pain patient, for example, we'd have a look at that ankle and see how the ankle's moving, see how the hip's moving, and potentially see how the back's moving, and how these things all kind of move together, and how that might change by a mechanical load. Essentially, it's a bit like, I use the analogy in clinic of being at work in the office. You know, if someone calls in sick, the work still has to be done, and so everybody else takes up the extra work, and that's okay, and you can kind of get away with that maybe for a short period of time. And depending on how big the team is, I suppose in the analogy, if you use the quadricep analogy, depending on how big the team is, or how big the strength, how much strength you have, depends on how long you can get away without that team member. But eventually it will come round, and it will catch up on you, and it will cause an issue. You know, in the office, other people might start getting sick, things might be missed, and the work's not being done as effectively or efficiently or as well as it should be being done. And I think those things are often identified in a subjective history of what's not doing its job that should be doing its job. So have you had a previous ankle injury, you know, and so now your ankle movement isn't quite so great, which then means that your ankle isn't doing so much work for you. That work still needs to be done. So where's it going to? Well, okay, so your knee is painful, so maybe it's going to your knee. Or maybe you've had a hip replacement, and ever since then you've had a pain in your knee as a result. Okay, so is there something that's going on, or was rehab efficient enough at the hip in order to make sure that the knee doesn't have to take over from what the hip's not doing anymore? These are the kind of the thoughts and the processes that we would be going through. So what I would do is start to look at some of those other areas, and when you start to identify those areas, these 90% close to their full capacity guys will see a much quicker change than if you purely focus on quadricep strength. So I think it's really important, particularly in an athletic population and a sporty population, that we're looking past strength some of the time and looking onto other things that people could be doing. So I hope that's helpful. I hope you found some use from that. If you're somebody suffering from pain, then it's a good idea to measure strength and things, and that's an easy and relatively safe way to start to work on an injury yourself. And I would encourage you to see if you can get some measure of strength if you're going to do that. I think that's really important. You want to know where you are now in order to be able to move yourself forward. So I would have a look at strength, but also start to think back to some of your other injuries. The tip I'd say is think about your hamstring. It's really common for people I see who have knee pain to actually have a previous hamstring injury that wasn't identified, and unfortunately I think also in the gym we would always favour anterior, so front of the leg exercises as opposed to back of the leg exercises. So working your quads are generally something that most people favour more than working their hamstrings, and so it might just be a good idea to kind of think about that a little bit too, and start to address that hamstring strength and improve on that. So if you have any questions, obviously leave a comment. Let me know what they are. I'll try and answer as best I can. Obviously you have to be a little bit careful with medical legal stuff, but drop a comment, and I'll see you next time. Cheers.